Good evening, everyone. My name is Tiziana Rivera, and I'm the Chief Nursing Executive, Chief Practice Officer at Mackenzie Health. And as a member of the Mackenzie Health leadership team, it's a privilege to be here to speak to you tonight to discuss the current activities related to what we're doing at Mackenzie Health related to creating an exceptional patient-family experience. What we've heard from Altaf and Dr. Herman is really looking at what our future state is and wanting to give the community an understanding of some of the initiatives that we're doing now to care for our patients. So as a member of the staff, we are consumed with understanding what is an exceptional patient and family experience, and how do we create that individually and collectively in our interface with patients and families. And so we've looked at this concept from 4 different areas: excellence, patient's voice, caring, and leadership. And we've looked at each of those concepts and understanding how do we look at each one and specifically do activities that demonstrate to our patients and families that we are committed to creating that experience for them. So when we look at excellence, we have focused on 3 particular pieces that I'd like to highlight today. One, and it's a major initiative, is we are a best practice spotlight organization. That's a designation that's given to few hospitals within Ontario, and it's an award that is done with the Registered Nurses Association of Ontario with funding from the Ministry of Health and Long-Term Care. And as an organization, Mackenzie Health has implemented an unprecedented 21 best practice guidelines. And what that means is that as patients are receiving care within our organizations, we are providing care that's based on evidence. And so our interprofessional team members, our nurses, our physicians, our OTs, PTs, social workers, are delivering care that is evidence-based. And so that has allowed us to standardize processes, standardized equipment, and so patients are able to get the best care possible. In our, as we're moving forward in developing our vision, we are keenly aware that we have vested interest in our current environment and how to optimize the current environment for creating that experience for our patients and families. We are currently engaged in what we're calling a game-changing innovation unit. We have designated one particular unit within the hospital as our innovation unit. And as we are planning for the hospital in Vaughan, we want to ensure that what we're choosing in terms of our technology and our processes of care are going to work. And so we are refurbishing and redoing one of our units to implement some of the technologies that will be live at Mackenzie Vaughan. We want to ensure that those mechanisms come together to be able for clinicians to deliver high-quality patient care, but we want to ensure that we are putting the right structures in place here at the Richmond Hill Hospital so that there is equity in how we're delivering services and care. Altaf mentioned that we won a national award related to our smart pumps. With the help of our foundation, our board, and our senior leadership team, we've invested significant resources to be able to purchase over 400 infusion pumps. And so these smart pumps have the ability or have a drug library inside the pump that is wireless. And so when a nurse is hanging a medication, chemotherapy, an antibiotic for our smallest of neonates, right across the age spectrum, our drug library is able to be pulled up, and nurses are able to get to access the right drug, right time, right dosage for the patient. And so we have eliminated hundreds of potential errors through the standardization process. And we've been recognized for that initiative because not all hospitals are doing it. We are the only hospital in Canada who has done this kind of a turnover with this particular technology, and it was recognized in a national award for patient safety. From a patient's voice perspective, we have set out to understand the experience from a patient perspective. Although we live and we work at Mackenzie Health, sometimes we're not always have the perspective of our patients. And so we purposefully go out and connect with our patients and families and find out what was it like for you to receive care in our hospital. And so we do a number of things to hear that voice, not only verbally, but in a number of different ways. And one of them is through our pulse and patient satisfaction surveys. So patients who come into our hospital, we take a pulse, not a physical pulse, but a pulse in terms of the services that we provide, and they give it to us in an anonymous survey that they leave with us, and we collate those results, and we do a continuous quality improvement to be able to ensure that we're being attentive to the needs of patients and in a timely manner. We also engage in with NCR Picker. It's a national research center that sends out surveys to our patients, and patients are able to give us feedback, again, anonymously through a written survey, and we take those surveys very, very seriously. We do a lot of analysis on them, all for the process of understanding what the experience is like and looking at how do we improve that. Our discharge checklists and phone calls, again, it's a methodology for us to understand the experience of patients and hearing their voice. And so everyone who is discharged from the hospital receives a discharge checklist to ensure that we are hitting all the top pieces that you have told us are important. So medication reconciliation, your next physician's appointment, and care activities and care and how you can resume your work and lifestyle activities. So all of that is through a discharge checklist, and we are the first hospital in Canada to implement an automated discharge phone call. Our introduction is led by our EVP Joanne Marr through telephone, and then it is an automated response so that patients can actually give us feedback. And individuals who wish to have a return phone call, we follow up with every patient that requests a follow-up phone call. Again, all towards creating an exceptional patient-family experience and understanding the patient's voice. Our patient care redesign is a significant process where we're looking at how do we deliver services and care. We're listening to our patients and we're reorganizing how we deliver that care. So it's everything from when nurses and physicians come and round to when we're giving medications, and we're looking at how do we bring clinicians closer to the bedside, because that's what patients have told us. And so this has driven a lot of our work, and it's also informing our work to our build in Vaughan. Altaf mentioned that he actually chairs or co-chairs a President's Advisory Council, and that's an opportunity for community members to be giving direct feedback to the CEO. And I was invited to speak at the council, and it's a phenomenal group of community members who are very attentive and very articulate in giving us feedback on how we can move forward in this creating that experience. The third initiative is around caring, and we've identified three pieces that want to highlight, and that is around our empathy. So we know that our clinicians are very empathic. We know that they deal with life experiences along with our patients and families. The piece is that we don't always demonstrate those behaviors of being empathic, and so we are working with clinicians to look at how do we demonstrate empathy, how do we demonstrate that we care, so we feel it, we want to be able to show it. One of the things that patients have told us is that hospitals are not the quietest environments. It's supposed to be a healing environment, but we're not always very quiet. And so we're creating opportunities for hush. So it's help us support healing with a better night's sleep, and looking at all the noises that disrupt that sleep pattern so that our patients have an environment where they are able to heal. And the other piece is everything that we're doing is aligning with our Mackenzie Health values around excellence, leadership, and empathy, so that when we're bringing these initiatives forward, it goes back to our mission, vision, and values, and that's something that's a core of importance to us. The last piece is looking at leadership, and we know that if we're going to transform the healthcare experience for our patients and families, we need to start with the leadership. And we have engaged all of our leaders, LTOF, all the way across the organization. We're doing leadership rounding as well as patient rounding. So it's an opportunity for us to connect with our patients, and specifically at the unit level for managers to connect up with patients and understand their experience so that we can do just-in-time correction of any experiences that are not necessarily going in the right direction. We have really developed a culture of accountability so that there is a sense of ownership by the staff and the leaders around doing the right thing at the right time so that our patients are the benefactors of that. And we're just embarking on this one around the I am patient experience, and it really is about giving voice and leaders demonstrating and stepping up and talking about the importance of creating that as a culture within our organization. So all of this to say that we are a highly engaged team that is moving forward on ensuring that what's happening now at the Richmond Hill site this is our focus. It's about the patient experience. It's about how do we create that environment for healthcare team members to easily enact this and create that experience for our patients and families. Thank you.